I'm Dr. Henderson. Today we're going to talk about sinus headaches. What is a sinus headache? People will come in and tell me they've had chronic sinus problems. Many times they've had many antibiotics. They don't seem to do any good, and they then find themselves coming to my office to find out what is going on. Many times, as I said, they've been treated with antibiotics, and then of course they get the aggravations that go along with antibiotics. Sometimes some patients will have yeast infections, some people will have diarrhea and upset stomach from taking the antibiotics. So my question to them is, what were your sinus infections doing to you? Most of the time they say that they have pain in the face. They complain of pain here and on their forehead and in their cheeks and around here, and this is what they're calling a sinus headache. I ask them then, what color is the mucus that is coming out of your nose? Most of the time they will say, well, it's a little cloudy, it's clear. They don't say that it is yellow greenish pus. Bacterial infections produce pus. We know that when we have a cold, we get clear drains from our nose. When we have allergies, we get clear drains from our nose. It's when we have the discolored mucus going toward the creamy yellow, the light creamy material, and going into yellow, thick mucus coming from the nose and hocking it back and spitting it out. If that's happening, then this is a sinus infection, and this is something that would need antibiotics. But if they say that they have not had any discolored mucus and they've gotten several episodes of antibiotic treatment, then they're doing their bodies more harm than good. They may have a little bit of improvement for a day or two, and sometimes that's just an effect of doing something positive for something that they think is causing the problem. So when I examine them, we look at their nose, we don't see any evidence of infection or inflammation. We look at their ears and we look at their throat and we don't see anything, drainage or anything. Then I will put my fingers in front of their ears and press and tell them to open their mouth. If they have the pain, this is a problem that has to do with temporomandibular joint. This occurs primarily at night while we're sleeping, and it causes the clenching of the teeth. That causes problems with the chewing muscles here, and also sometimes pain around the side of the face and the ear. And this is the way that the body produces the pain that they're now calling a sinus infection. Like we said, a bacterial sinus infection will cause yellow pus. Many of the people will say they've had multiple antibiotic treatments, and I'll ask them, what did the x-ray show of your sinuses? Well, they haven't had an x-ray, so they don't know whether or not there's a sinus infection or not. They're just going by their symptoms and having headaches, which they think is due to their sinuses. In the process, we get a sinus x-ray because they've already had multiple antibiotics. The sinus x-ray comes back within a day or two. There is no evidence of any sinus infection. Then I know for sure this is a problem with the jaw joint. So people who are teeth clenchers and are having other stressful things will end up probably clenching or grinding their teeth in their sleep. And this is one way if someone hears them doing this in their sleep, then we know that this is more of a tooth clenching problem or a temporomandibular joint problem than it is a sinus problem. One of the causes of clenching the teeth is interrupted sleep. And we'll get back to one of my more favorite topics. It's what's going on with the GI tract, the intestinal tract. When we have acid leaking up into the esophagus at night, when we're coming from the stomach up into the esophagus, this sends a message to the brain that there's something foul coming up. So the brain arouses you out of the restorative level of sleep so that your swallowing mechanism takes it back down. If this is happening multiple times at night, then your sleep is interrupted and becomes very inefficient, and people may sleep all night long, but they wake up just as tired as they were when they went to bed. This is an increased stress. The body overcomes stress, we know from exercise of whatever. And if people are not doing regular exercise in the gym or walking or running or anything like that, their body is going to do this exercise by clenching the teeth at night. So when this happens, with the way they stop the clenching their teeth, is they have to get a tooth guard. The dentist will be glad to make you one for $600 or $700, which is not covered by insurance. What I tell people to do is go to Walmart or Target into the sports section and buy the tooth guard the little Pee Wee football players have to wear to keep their teeth getting cracked when they're playing sports. This is the kind you have to put in hot water. You put it in your mouth and you bite on it, and it forms to your teeth, and you wear it to sleep every night. How this works is, the example I can give is I can take a rubber ball and I can hold it in my fist like this for a long time. This is my fist, my muscles are locked down. If I take this same ball and I squeeze it multiple times like this, after a while, the muscles get sore and they stop doing that. This mouthpiece pushes back. It is made of a silicone rubberized compound of some kind that I don't know what it is, but anyway, it gives, but it pushes back. So if you're clenching your teeth, it pushes back, it pushes back. It's telling these muscles in the chewing area to relax and stop doing that. The masseter muscle is here on the side of the head. This is why people get pain in their heads. The muscle here, the masseter muscle here on the sides is the one, is also one that's causing pain actually in the sinus area. So it's understandable why people would think they have a sinus problem when the problem is really a problem with muscles clenching and damaging the temporomandibular joint. This takes us back to why we're having the acid reflux. This takes us back to the gluten problem. Gluten is the primary cause for acid reflux, period. I don't really care what the gastroenterologists say. I don't care what the primary care doctors say. The problem is gluten. Mechanically, you need to raise the head of the bed 4 inches, and I think we talked about that in the first episode. Raising the head of the bed 4 inches keeps the acid in the esophagus because water normally doesn't run uphill. It has to be pushed. So raising the head of the bed and wearing a tooth guard will take the pressure off your esophagus, stops interfering with your restorative level of sleep, so you're not stressed enough that you're clenching your teeth. If you find you're clenching your teeth during the day, then you might want to wear one during the day until your body gets out of the habit of doing this. So sinus headaches may not be sinus derived. This is why after multiple antibiotics we get a sinus x-ray to make sure, and then we test the jaw joints, and generally speaking this is the primary cause for the sinus headaches that people are talking about when actually they don't have a sinus problem.